when we're in the oral cavity, we have a lot of things that we have to contend with. And one of the primary things we have to contend with is the bacteria flora of the oral cavity. We know that that constant bathing of saliva over the surgical site that we've created or what we are trying to heal up becomes an important problem of being able to control the bacterial activity in that area. The different types of tissue that we have to deal with the idea that there is, we have both keratinized tissue and mucosal tissue. And the fact that the oral cavity is constantly working and functioning with speaking, eating, drinking, breathing are all movements that need to be made accordingly. And trying to have all of this being done and applying medications that are non-cytotoxic that can be ingested and will not damage, the rest of the GI tract becomes very important. In the oral cavity, we can't apply bandages for the most part to our soft tissue. Possibly a periopac around a periodontal surgery is a possibility, but other than that, it's really limited in what we're doing. And we need to make sure that we understand the anatomical functions of the tissue we're treating, as well as what are the movements and the actions that tissue will be taking during that healing phase. So looking at what are the primary things that we can use in the oral cavity comes down to basically ointments and oils and things along that line that lead us to get the outcomes that we're looking for. The oil of thyme it has good potential to being incorporated because it can create an antibacterial and a permeable films for a wound dressing. The antimicrobial effect and the antioxidant and the anti-inflammatory component of the oil of thyme really makes it beneficial to give us the potential to getting the growth stimulation that we're looking for. And this is very, very important. The effect of the oil of thyme that is shown on various microbes as you're treating again the viruses, herpes simplex, influenza, strep mutans, and gram-negative bacteria are very important to what we're doing within dentistry. And these have very synergistic effects if they're used in combination with other oils such as cinnamon. And so looking at this being able to be antibacterial, antifungal, and literally giving us the outcomes with a very low amount of toxicity. And so looking at combining these oils together gives us the outcomes that we're leading in the right way. Control studies have actually shown that the topical administration of cinnamon in particular has remarkably shortened that inflammatory phase and therefore moves us quicker into the secondary field than increase the healing, taking us out of the painful stage and now into the regeneration stages, which is where we want to be. We have something that is non-toxic and is drug-free that we can use that actually has FDA 510K marketing clearance to be used for oral wounds. This has both a gel that we use routinely and that will apply directly to any sort of wound that we have in the mouth, whether it's an extraction, whether it's a frenectomy, whether it's any other type of surgical site, whether it's an osteotomy or an implant placement. And then there is a mouth rinse that basically is a watered down version. The original formulation of this, I believe, was designed for pharyngeal cancer patients to literally take the oral rinse, swish it around, and then swallow it to relieve the discomfort of the pharynx, as well as to reduce the microbes that are on that cannot be treated any other way. Anytime I have an open wound, we're applying this gel to the wound directly as part of the treatment. We stopped using chlorhexidine in my practice a long time ago when you start reading the studies that are showing that chlorhexidine by itself is actually in turn destroying the exact cells that we're trying to grow. At a concentration of 0.00009% has been shown to be extremely cytotoxic to gingival fibroblasts. So why in the world are we actually putting this on a wound and having patients rinse with this after we've done treatment? It's almost completely counterindicated because of the effect that it has on this. It's a great antimicrobial agent, but it's also very cytotoxic to the cells we're trying to generate at the same time.